Did you know ancient civilizations performed surgeries and treatments that still shock modern doctors today? And no, these weren't some primitive rituals with questionable results. We're talking about genius-level medical interventions that saved lives long before the invention of modern hospitals. Let's start in ancient Peru. Archaeologists have found skulls, some dating back 3,000 years, that show clear signs of successful brain surgery. This procedure, called trepanation, involved drilling or cutting a hole into the skull. It was used to treat head injuries, relieve pressure, and possibly even address neurological disorders. What is truly astounding is that the survival rates for these ancient surgeries were often higher than those in 19th century Europe. The bone regrowth around the surgical sites proves that many patients not only survived the procedure, but lived for years afterward. Imagine that brain surgery thousands of years ago with a shockingly high success rate. Now, let's travel to ancient Egypt, a civilization known for its pyramids and pharaohs, but also for its surprisingly advanced medical practices. Egyptian doctors were masters of wound care. They used honey, a natural antiseptic, to cover wounds and prevent infection, a technique we now understand is incredibly effective due to honey and its antibacterial properties. They would stitch up deep cuts using linen threads, sometimes soaked in tree resin to further seal the wound. The Ebers Papyrus, one of the oldest medical texts in the world, describes hundreds of remedies and procedures. And they had the tools to back it up. Excavations have unearthed surgical kits containing bronze and copper instruments that look remarkably familiar. Scalpels, forceps, probes, and even catheters. They weren't just treating symptoms. They were performing complex medical procedures with specialized tools. Next up, we're heading to ancient India, where a legendary surgeon named Sushruta was performing medical miracles over 2,500 years ago. Known as the father of surgery, Sushruta's famous text, the Sushruta Samhita, is a comprehensive guide to medicine and surgery. It describes over 300 different surgical procedures and lists more than 120 surgical instruments. Sushruta is particularly famous for pioneering cataract surgery, using a curved needle to push the clouded lens aside and restore vision. But perhaps his most famous contribution was in plastic surgery, specifically rhinoplasty or nose reconstruction. His techniques for rebuilding noses, often lost in battle or as punishment, were so detailed and effective that they formed the basis for modern plastic surgery methods developed centuries later. How did these ancient surgeons manage pain? Let's look at the ancient Greeks. Long before modern pharmacology, they had a deep understanding of anesthesia. They used powerful plant-based substances like opium, derived from the poppy and mandrake root, to sedate patients and dull their senses during surgery. The physician Dioscorides wrote extensively about the properties of these plants in his work, De Materia Medica. He detailed how to prepare and administer them to induce a state of anesthesia, allowing surgeons to perform painful procedures without the patient writhing in agony. This sophisticated approach to pain management was a crucial element that allowed surgery to advance beyond simple, quick amputations. Meanwhile, in ancient China, a completely different approach to healing was taking shape. For over 2,000 years, practitioners have used acupuncture to treat a wide range of ailments. The underlying theory involves balancing the flow of qi, or life energy, through pathways in the body known as meridians. Ancient texts describe the use of finely crafted bronze and even gold needles, which were inserted into specific points on the body to alleviate pain, reduce inflammation, and treat internal illnesses. Archaeologists have discovered these needles in ancient tombs, along with charts mapping out the meridian system. It is a holistic system of medicine that has stood the test of time and is still widely practiced around the world today. Let's swing back to Europe, to the mighty Roman Empire. The Romans were masters of engineering, and that extended to their medical instruments. They developed highly specialized surgical tools, including arterial clamps to control bleeding, bone saws for amputations, and vaginal speculums. What is incredible is that some of these designs are so practical and effective that they have remained virtually unchanged and are still recognizable in modern surgical kits. Roman military doctors were particularly skilled, setting up field hospitals to treat wounded soldiers. They performed complex procedures like cesarean sections to save babies from dying mothers and carried out amputations with a level of skill that maximized the chances of survival on the battlefield. Now, let's explore the medical knowledge of ancient Africa. Long before laboratories and pharmaceutical companies, healers across the continent used a vast botanical pharmacy. They created herbal poultices to treat wounds and infections, using plants with powerful antiseptic and anti-inflammatory properties. For example, extracts from certain types of tree bark were used to clean wounds and prevent gangrene. Many of these traditional remedies, passed down through generations, have since been studied by modern scientists. Researchers have discovered that these plants contain active chemical compounds that are now used in the development of modern medicines, proving that ancient healers had a profound and accurate understanding of pharmacology. Over in the Americas, the Maya civilization possessed a surgical tool that was sharper than anything available in Europe at the time, the obsidian blade. These volcanic glass blades can be flaked to an edge just a few molecules thick, far sharper than a modern steel scalpel. This incredible sharpness allowed for cleaner incisions with less tissue damage, which likely reduced pain and infection rates. The Maya were also skilled orthopedic surgeons, using splints and plaster-like substances to set broken bones and treat fractures. They also practiced bloodletting, sometimes using stingray spines, as a therapeutic procedure to rebalance the body's humors, a common medical theory in many ancient cultures. Finally, let's go to Mesopotamia, the cradle of civilization. On ancient clay tablets, we find some of the earliest medical records in human history. These cuneiform texts describe diagnoses and treatments for a variety of conditions, from wound care and fevers to what we would now recognize as psychiatric symptoms like depression and anxiety. What is truly revolutionary is that they made a connection between a person's emotional state and their physical health. They believed that feelings of guilt or anger could manifest as physical illness. This mind-body connection is a concept that modern medicine has only recently begun to fully appreciate, yet Mesopotamian healers understood it thousands of years ago. So, from brain surgery in Peru to plastic surgery in India and psychiatric insights in Mesopotamia, these ancient medical techniques were not myths or primitive guesses. They were real, often startlingly effective, and incredibly ahead of their time. These ancient doctors and healers laid the groundwork for the medicine we rely on today, using ingenuity and observation to save lives in a world without our modern technology. Which one of these ancient medical marvels blew your mind the most? Was it the obsidian scalpels or the successful brain surgeries? Let me know your thoughts in the comments below. I read every single one. Thanks for watching, and don't forget to subscribe for more deep dives into history.